Baloxavir Marboxil for uncomplicated influenza in adults and adolescents. Definition: influenza, also called flu or grippe, an acute viral infection of the lower or upper respiratory tract that is marked by fever, chills, and generalized feeling of weakness and pain in the muscles together with varying degrees of soreness in the head and abdomen. Baloxavir marboxil is a selective inhibitor of influenza cap-dependent endonuclease.
The emerging resistance of influenza virus to antiviral agents is a growing challenge. The influenza polymerase complex is essential for the replication of influenza A and B viruses. Baloxavir marboxil is a small molecule prodrug that selectively inhibits cap-dependent endonuclease, preventing polymerase function and influenza virus mRNA replication. Capstone 1 was a randomized double-blind placebo-controlled trial that evaluated the efficacy and safety of baloxavir as compared with oseltamivir in a phase 3 trial. 1,436 patients between 12 and 64 years of age were enrolled if they had fever, one or more systemic symptoms, and one or more respiratory symptoms within 48 hours of onset. The patients were randomized to receive a single dose of baloxavir or a standard 5-day course of oseltamivir or placebo. The primary efficacy endpoint, which was assessed in 1,064 patients with proven infection, was median time to the alleviation of acute influenza symptoms. Time to alleviation of symptoms was shorter with baloxavir than with placebo, but similar with baloxavir and oseltamivir. The virologic endpoint evaluated change in infectious viral load. There was a more rapid decline in infectious viral load with baloxavir than with placebo, and a more rapid decline than with oseltamivir. There was no difference in adverse events among the three groups. The authors conclude that single-dose oral baloxavir was not associated with clinically significant adverse events and achieved clinical benefit and antiviral activity in uncomplicated influenza. Full trial results are available at nejm.org.
Cover story, and we're going to have more on that breakthrough treatment of flu that we were talking about in our first half hour. It's a new pill that is meant to reduce the length of symptoms. It was just approved by the FDA, and Dr. Jen Ashton is here with that. And we remember how deadly this flu season was last year. So what's the news here?
We're just getting into this year's flu season. Obviously, we're going to be covering it and watching it very closely. But let me tell you about this new drug. It's called Xofluza. What is different about it, it is one oral single-dose regimen. So that's one pill. It's approved for people of age 12 and up, and it could potentially reduce not just the symptoms and the duration of symptoms by 1 day on average, but how contagious someone is. We don't know totally that data yet, but it looks promising.
Okay, so we know about the symptoms. What about the possible side effects?
Listen, you always have to balance risks versus benefits when you talk about any treatment, any medication. And like Tamiflu or that class of antivirals, there are side effects here. The common ones, headache, a little GI distress, upset stomach. There have been some reports of some mood disturbances and some psychiatric issues that will be being followed for sure. But again, we have to remember the flu-related deaths, over 80,000 in the U.S. last year.
80,000?
So, absolutely. So it is very big news that we have a new drug in our arsenal. This works differently than Tamiflu, so that's generating some excitement.
So when will it be available and how much?
So those are the big questions. It will be available in the U.S. in the next couple of weeks. It comes with a big price tag. Its wholesale cost to the pharmacies is $150. For people with insurance, it could be as low as a $30 copay. And for people without insurance, insurance, there is a coupon available that can help them with costs, but it all comes down to whether your insurance will cover it.
It always does.
That's
so
right.
when people hear this, they're going to think, well, should I get the flu shot, do this in lieu of, or?
Absolutely. This is not an either or, okay? So, Robin, the CDC, we have to be crystal clear, is recommending that everyone 6 months of age and up get their flu vaccine by the end of this month. It takes about 2 weeks to get the protection. This is not a substitute. This is to reduce symptoms and severity by about a day and may help reduce complications. But do not, under any circumstances, think that because there are treatments out there that you can just roll the dice and forego the vaccine. That is not the case.
And we have to keep in mind what happened last year.
And you're going to be hearing a lot about it. We're going to be calling it Flu and You.
Okay. All right. Thanks so much, Jim. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe.
Applications in medicine. Single-dose Baloxavir was without evident safety concerns, was superior to placebo in alleviating influenza symptoms, and was superior to both oseltamivir and placebo in reducing viral load 1 day after initiation of the trial regimen in patients with uncomplicated influenza.
So I think that the most important take-homes are threefold. One, that antiviral therapy, including Baloxavir, reduces the incidence of complications in patients with high risk for complications infected with influenza. Two, it shows that Baloxavir, a new class of drugs, is both safe and effective in the treatment of influenza. And then the third critical finding is that there's a much more rapid clearance of virus with those patients who are treated with Baloxavir. In addition, there was superiority of Baloxavir compared to oseltamivir with the treatment of influenza B. So most importantly, it will bring a therapy that only requires a single dose. So patients will be able to take a pill and be done taking the medications for the treatment of influenza. And after taking it, they'll be at reduced risk of complications, including those requiring antibiotics or other complications of influenza. So the study, the Capstone 2 study, was a randomized controlled trial of ambulatory patients with confirmed influenza that had risk factors for complications of influenza. The patients were randomized to receive either Baloxavir, oseltamivir, or placebo, and then they took a single dose of the Baloxavir, 5 days of the oseltamivir, or matched placebo. The study looked at the outcome of clinical response in terms of time to improvement of symptoms, as well as virologic decline and incidence of complications, as well as the safety of the drug. The study basically found that the Baloxavir was superior to oseltamivir for influenza B viruses and similar to oseltamivir but superior to placebo for influenza A viruses. The virologic clearance of the patients was faster in the patients who received Baloxavir compared to oseltamivir and placebo, and the patients were tolerated the medications very well. In addition, there was a lower incidence of complications in patients that received either Baloxavir or oseltamivir.
Pros and cons. Pros. Baloxavir Marboxil is a small molecule prodrug of the selective PA inhibitor S033-44-7 that was shown nanomolar antiviral activity against influenza A and B virus in vitro, including strains resistant to current antiviral agents. Cons. Additional effective antiviral agents are needed for treatment and prevention of influenza virus infections. Two classes of agents, M2 ion channel inhibitors and neuraminidase inhibitors, are widely available. However, circulation influenza viruses are now largely resistant to M2 ion channel inhibitors, and the emergence of antiviral resistance to neuraminidase inhibitors remains a threat. Issue apply in Ecuador. Baloxavir Marboxil is a good option for reduce the symptoms of uncomplicated influenza in adults and adolescents. Baloxavir Marboxil effect could be studied clinically to determine if the treatment reduces the risk of resistance emergence and enhance clinical efficacy. Conclusion. In conclusion, single-dose oral Baloxavir in these modest-sized trials did not result in apparent safety concerns and was associated with clinical benefit and antiviral activity in patients with uncomplicated influenza.
Welcome to Medscape Morning Report. For the first time in 20 years, we have a new antiviral drug to battle influenza A and B. It's different from other antivirals like oseltamivir. The new drug, Baloxavir, with the brand name Xofluza, has a novel mechanism of action. It's a selective inhibitor of the enzyme influenza cap-dependent endonuclease. It blocks viral replication by preventing mRNA synthesis. In clinical trials, a single oral dose of Baloxavir significantly reduced the duration of flu symptoms and fever compared with placebo. The patient's symptoms resolved 23 to 28 hours sooner. Its efficacy in symptom reduction is similar to oseltamivir. Like the older drug, it must be given within 48 hours of symptom onset, and is more effective if given within 24 hours of flu symptoms. Baloxavir seems well tolerated. The most common adverse reactions were diarrhea and bronchitis. As far as differences when compared with oseltamivir, patients with uncomplicated influenza who received Baloxavir had a shorter duration of viral shedding. As the new drug becomes available, researchers will follow to see if resistance emerges with this one-dose drug, and to see if combination therapy with Baloxavir and oseltamivir may be useful for some groups of patients. For now, Baloxavir is approved for patients over age 12.